Camille. Great. Okay, we got that started. All right. A couple of comments before we get into that, into the meeting itself. We don't ordinarily have a meeting in November and December. We have one meeting and we've got a date in mind. And what we need is your feedback. Do we want to have a meeting on December the 7th or January 25th? That's the two possible dates that we could pick from based upon speakers and topical areas. So I need your feedback on that. Send me a note what's most readily available to you, either December 7th or January 25th, and we'll try to work around that. It's item number one. Item number two, dues are available, dues are becoming collected here, beginning here in December and January, and would appreciate it. We're going to send the dues to you, the dues invoice to you, the delegates. The last time we tried to send it out to people you pointed to, and administration would claim they never got it or they were very delayed and so forth. So we'd appreciate your cooperation with regards to the dues invoice. A point of reference, the new address, we are no longer located at 9055 Ibis Boulevard. That's that small building that was in the front of Ibis. Now the building's not going anywhere. We've merged our boards of the POA and our club. So the mail and the staff of the POA have moved to 8225 Ibis Boulevard. We sent that out in an email previously, but in case you hadn't got it, that's the main clubhouse at Ibis. That's basically where we've had the big annual meetings, the ballrooms and so forth. That's where our mailboxes will be located. So Pam and Andrea and other folks that you might have interfaced with from the POA are now going to be located up at the Ibis ballroom headquarters or main clubhouse. And that's where our mail will be delivered. I go by there almost every other day and see if there's anything. So it's 8225 Ibis Boulevard, same zip code 33412. Two subjects that we've been following very closely. One with many of the communities along North Lake Boulevard is the county has designs on widening North Lake Boulevard. I appreciate everybody's support. All of you have been in touch with me from all the communities, whether it's Bay Hill, Carlton, Osprey, obviously Ibis, PGA National, Ballin-Isle, Carlton, Steeplechase, and Montecito have all either have gotten letters or are aware of the situation and reviewing it with their boards. Many of the communities have sent me copies of their letters and they've been sent to the commissioners. I've been in touch with almost all commissioners at this point in time, letting them know that we're going to make an appearance on February the 2nd when the Board of County Commissioners are going to be presented this particular recommendation to widen North Lake either to 6 lanes and then eventually possibly to 8 lanes. The consensus opinion of all the communities is 6 lanes does not appear to be an issue. However, when you go to 8 lanes, you begin to take property from some of these communities or right-of-ways or deceleration lanes or acceleration lanes. In Ibis's case, they would take our park that we have that was adjacent to the POA building. They would remove the deceleration lanes and the acceleration lanes. And that's pretty common amongst all of the communities. So that's been going on. Second major subject in the county that's going on that just got launched is redistricting. There's a whole series of meetings that are going to be starting here in the latter part of October, November. The county would like to get the redistricting accomplished and done by the end of the year. And it's going to necessitate, if you have issues with redistricting, or if you're not familiar with what it is, call me and I'll brief you. But if in fact you wish to get redistricted, which I don't think most of you will, we may as a community, we tried this 10 years ago to come back into Palm Beach County District 1, but that was not approved, so we stayed with District 6. So redistricting is a topic of discussion on everybody's lips right now in the county. Okay, so those are my comments up front. Any questions on any of those? Okay, we're good. Okay, I need approval for the September 21st meeting minutes that were sent out to you electronically.
I move that we approve the minutes.
Okay, do I have a second?
Last meeting.
Second.
Okay, thank you. Okay. The second item is the October 21 Treasurers Report. We sent that out to you electronically as well too. Need a motion?
I move that we approve the treasurer's report.
Okay, a second. Do we have a second?
Let someone else do it. Yeah.
Okay, Jim Levin is seconding. Okay, great. We appreciate it. Okay, so all right. I'm assuming everybody approved, all the yeas, all the nays. We've never had one of them not be approved. So thank you very much. Appreciate that. Okay. So now we go into the main meat of the program, and that is our speakers. And we've got a real good list of speakers here today, a good lineup. Some of them have been before us before, but I don't think she needs any introduction. You know, the Gardens Hospital has been a prime supporter of the NCNC over the years. And through a variety of CEOs, but most recently Teresa, she has really taken this to heart. I mean, every time she gets up to present, either at our annual meetings or at the monthly meetings, we get very positive feedback, and she's always got something very pertinent to state. So Teresa, they're all yours.
All right. Thank you, Sal. It's nice to see everyone. It's actually been a while, I think, since I've been, I have been able to attend one of your board meetings. So I thank you, Sal, and everyone for this opportunity. And, just to kind of recap, we are very excited to partner with the NCNC. And I would tell you that, as Sal mentioned, if you do have a need or any of your community members have a need to be in the hospital, please let me know. And we can certainly reach out to them while they're here and make sure everything is they're as comfortable as they can be. The other thing I would let you know is that in your communities, if you have an interest and would like for us to do any kind of screenings, we recently did one at Ballin-Isle that was very well received. We were able to do some health screenings for folks there. And I just wanted to make sure that everyone was aware of that. And also, if you have any topics of interest in your communities, we have obviously lots of physicians on our medical staff, and depending on what the topic might be, we may be able to assist you with that as well in terms of providing physician lectures and some of those kinds of opportunities. So if you have anything like that, please don't hesitate to reach out to myself, Lisa Cook, who is here with me today. Some of you may remember Megan Orzak. She was my marketing manager. She resigned back in the summer and is now working for Carrier, I believe, and wish her well. And Lisa is helping me out in the interim while we recruit for a marketing manager here. So this is Lisa. So she can also help with any of the opportunities that you may have in your communities that we can assist you as your local community hospital, so we're happy to do that. The other thing I would say is that you all know that Palm Beach Gardens Medical Center has been providing the healthcare needs of our community for over 50 years, right? I could probably quiz you guys and ask you, when did we open our doors? You probably know. That was in 1968, which was a long time ago. I know a lot of people say, oh yes, that was the cow pastures and all that kind of good stuff. Well, obviously over the years, things have changed. We started doing open heart procedures in 1983. And we did that here. We were the first hospital in Palm Beach County and the Treasure Coast to be able to provide that service to our communities. And we're happy to be able to continue to do that today. In fact, over the years, we've expanded our offerings of what we have for our communities in terms of healthcare services. At Palm Beach Gardens, we are obviously noted for our Heart and Vascular Institute, our emergency services, our orthopedics, and knee replacement, hip replacement program, which I think at your annual meeting, we had one of our robotic assisted technologies there. And we've actually upgraded that recently to the Corey. So we're excited about that. Maybe at the next annual meeting, we can do something fun as it relates to the robotics that we have to offer. So with that, we also have our Advanced Primary Stroke Center here at Palm Beach Gardens. We also do urology. We've really expanded our urology services over this past year, I guess I would say. And so we're very excited about the urology services that we have to offer to the community. And we have many physicians on staff that do really well and are great speakers. And if there's opportunities for anything like that, we're happy to do that.
I mean, interrupt you there, Teresa, but I have to let you know, when I had my urological surgery, you did employ one of those robots on me.
See, yes, exactly. So we have
the testimony to the fact they work.
That's right. Thank you, Sal. Sal, yeah, you've had a lot of our services here, which I'm
cardiac,
glad to see you're doing well. Yeah, living proof,
them,
right? But we do have the urology, general and robotic surgeries. And we also have our outpatient rehab center, which is down the street, where we do cardiac, pulmonary rehab and physical therapy, diagnostic imaging services. So, over the years, these are the services that we have continued to further to develop and refine. And you're going to see more and more of that in the coming year in 2022 for some of those service lines. And we'll be able to provide you with some of those insights. You have to brag on your team, right? So I'm very fortunate to work with a wonderful team of caregivers and ancillary staff here. Just like any business or any sports analogy, whatever you want to use, it takes a team effort to make things happen every day, right? It's not just one individual person that makes it happen. It's the entire team. And so I'm really proud to say that our team for 2021 earned high performance in the treatment of COPD and heart failure in U.S. News and World's Best Hospitals for the 3rd year in a row. So again, that's meeting certain standards, and our team has done a good job with that. This year in 2021, we also earned high performance in the treatment of stroke in U.S. News and World Report's Best Hospitals as well. And along with that, we earned Get With the Guidelines Stroke Gold Plus with Target Stroke Honor Roll Elite from the American Heart and the American Stroke Associations. And it's kudos to my team and all the people that have a component of this, so that we provide great outcomes to our patients and provide great help to our communities. When it comes to your health, we know that you deserve a hospital that is pioneering the latest breakthroughs in medical procedures, offering exceptional technology and the highest quality award-winning care. And so at this time, I'd like to take a few minutes and just show you a short video that I think, Camille, you're going to help me tee that up. And it just show you all the different services that we have to offer to our wonderful community. Okay?
Okay, give me a second.
You betcha. But again, I just really want you all to know that if you have anything, feel free to reach out to me directly. And we want to be able to provide you with what your communities may need when it comes to healthcare. We're here for you.
I'm getting there. Give me 1 minute.
Camille, I'm not hearing volume. I'm not sure if anybody else is or not.
Okay. I have my volume all the way up. No one else is hearing volume either?
No, Camille, this is Sal. I don't hear him.
Okay.
While you're doing that, let me acknowledge a couple of our elected officials and city managers. Ron Ferris is on the Zoom here today. Karen Marcus is on the Zoom. Mayor Litt's on the Zoom. Marcy Tinsley's on the Zoom. Joe Abruzzo's office is represented as well on the Zoom. I think I see Chelsea Reed. There she is down in the corner. Okay, I got you. Council member of Palm Beach Gardens.
Okay, let me see if this. Can you hear it now?
Thank you, Camille. So again, just wanted to kind of give you a run through of some of the things that we're doing here at Palm Beach Gardens. And I would tell you that you saw that we've been doing 35 years of our heart. And I also can tell you that we've done more open heart surgeries than any hospital in Palm Beach County. So again, hats off to the team and the work that they do here at our hospital. And really, Sal, that's what I had for today. Just wanted to give you guys a brief update of what's happening at the hospital. So I thank you so much for your time.
Okay, are there any questions for our CEO from the hospital? Any from the community? I've got one, but I'll give everybody a chance to speak first. Okay, any perspective you want to share on COVID with regards to the status at the hospital?
You know, everything's going really well as it relates to that overall, just like all the other hospitals in, our area have seen a decline in the numbers of the COVID admissions, which is very nice and very positive. And again, our team has done a phenomenal job with this pandemic that we've seen for the last, almost 2 years now. And so again, it's just, we're learning to deal with COVID within the world that we live in. And I just think that's where we're going to be as we move into the future. But yes, things are very good here from that standpoint. Thank you, Sal.
Okay, great. Okay, last call for the CEO from Palm Beach Gardens Medical Center. Anybody got any questions? I see a hand up, or is that Ray that, no? Okay. Well, thank you, Teresa. Appreciate your time. I know you got a meeting to go to. We appreciate your time and obviously your input and your support
Thank you.
for the NCNC. Thank you very much. Give my
All right.
best, everybody.
Thank you so much.
Okay. Now we have a speaker and I saw him. I got to find him on my screen somewhere. Where is Paul? Paul Owens. He is the CEO of he's the president of 1,000 Friends of Florida. He's no stranger to us. He's been before us once before. He's been very supportive of items with regards to the environment, and I'm trying to find him.
He's right next to Rick Morrell.
I'm sorry, I don't see. I see Rick Morrell.
And
But I
next
don't
to him is blank.
I got it. Okay. Hey, Paul, you're on mute. Paul,
There he is.
here he's coming. You're on mute.
Okay, and now I'm unmuted.
You're unmuted. Okay. Well, you're calling us from, where are you? At Gainesville, Tallahassee? Where are you today?
I'm actually in Jupiter at the moment because I was at a workshop that the Palm Beach County Commission conducted today on the agricultural reserve. And I was using the opportunity to testify at that and talk about our priorities about conservation and how the agricultural reserve is a good alignment with those priorities.
Okay. And you had asked if we could support your perspective on the ag reserve. I did call a couple of commissioners and asked for their support to maintain the reserve as we know it. As a native Floridian, I'm environmentally sensitive to developers who want to kind of take parcels of land away, and particularly water, which I know is a big issue at the ag reserve. So you got 15 minutes with my team here, Paul. They're all yours.
Okay, great. And I spoke to Camille earlier today, and I was going to let Camille go through my slides.
Got it.
Okay, great. So let's go to the first slide. All right. So thank you, Sal, for this gracious invitation. And I am, as you said, I have addressed NCNC before, but it was pre-pandemic. I'm pleased to have this opportunity to get reacquainted. Sal has been a supporter of ours for years, and so Sal understands what we do. But if you're not familiar with 1,000 Friends, we're Florida's leading nonprofit advocate of sustainable development. And since our founding in 1986, we've been partnering with citizens, community and state leaders, conservation and business groups, and others to build more sustainable communities where we save special places throughout Florida. We oppose low-density, sprawling development that depletes natural and agricultural land, and we're committed to empowering citizens like members of NCNC to engage successfully in the community planning process. Let's go to the next slide. Whoop. Okay, these are, if you want to advance past this one to, okay. Thought we had those, okay, yeah, if you would bring those up, that'd be good. So during our 35 years, we have developed some policy priorities that we pursue a year in and year out. And you can see them on this slide: protecting natural and agricultural land from development, restoring and protecting environmental treasures like the Everglades and natural springs, defending the planning process and citizens' role in it, expanding the supply of workforce housing, promoting transportation alternatives to cars and trucks, and increasingly in recent years, fighting the causes of climate change, doing more to prepare for sea level rise, flooding, and other climate change impacts. Next slide, Camille. So throughout our history, we've won a series of important victories for smart growth and sustainable development in Palm Beach County. Our most notable victory may have come 15 years ago when we played a leading role in the effort that led the Scripps Biomedical Research Institute to relocate the site of its new campus from western rural Palm Beach County at Mecca Farms east to the current infill site near existing roads and schools. We established the Palm Beach Martin County Green Initiative to promote sound community planning and effective advocacy in both counties. We've worked to maintain Palm Beach County's managed growth tier system to promote, to protect the county's quality of life. And that's what I was doing today before the Palm Beach County Commission, because the agricultural reserve is part of that tier system. Over the years, 1,000 Friends has challenged development proposals that we felt were inconsistent with the county's growth plans, including quite a few in the agricultural reserve. In recent years, as Sal knows, we've opposed the extension of State Road 7 because of the threat it would pose to the Grassy Waters Preserve. And 3 years ago, we conducted a pair of workshops in Palm Beach County to examine the potential impact of the projected population increase over the next 50 years on land use and water demand in the county. And these workshops were co-sponsored by NCNC. And finally, we are at the state capitol every year during the legislative session to promote priorities that we think benefit all of Florida, including Palm Beach County. And that's what I'm going to be focusing on for the next few minutes. Camille, next slide. Okay, so we do have a set of priorities that our staff and our board of directors has developed for the upcoming legislative session, which begins on January 11th. Our top priority is to empower citizens in the planning process. And this includes restoring the rights of citizens to challenge development orders that are inconsistent with local comprehensive plans. And to do so without worrying about being ruined financially for it. In 2019, the legislature changed the law to require citizens who file these consistency challenges and lose to pay the legal costs of the winners. That change must be repealed. It has virtually shut down citizens' consistency challenges. We also would like to see legislators adopt incentives for local governments to continue providing remote options for citizens to participate in public meetings. Options offered during the pandemic should be maintained, options like the one that we're all taking advantage of now. More citizen participation will lead to better decisions and better government. And I don't think I have to convince the members of NCNC of that. Let's go to the next slide. Our second priority for the upcoming session is for legislators to protect natural lands by maintaining funding for the Florida Forever program at a minimum of $300 million, its historic level. 3/4 of Florida voters in 2014 approved an amendment to the state constitution directing legislators to provide robust funding for land and water conservation. And the margin of victory was just about that total in Palm Beach County. So this was a popular initiative in Palm Beach County. We also would like to see legislators revive bonding authority for Florida Forever to maximize the impact of the dollars they allocate, at least to keep this option open, especially during a time of historically low interest rates. Okay, next slide, Camille. Our next priority is to protect and restore water quality. Legislators have invested billions of dollars toward this goal at the urging of Governor DeSantis, to his credit, but it's going to take many billions more. We are still seeing blue-green algae in our waterways, extended periods of red tide off our coasts, and waterways like the Indian River Lagoon are in crisis. We also think legislators need to implement more of the recommendations from the governor's task forces on blue-green algae and red tide. These include regular septic and stormwater inspections, better restoration plans for impaired waterways, and stricter measures to control agricultural runoff. This is dealing with water problems at the front end, not just the back end. And if you think it's expensive to deal with them at the front end, wait till you see the bill at the back end. It's the old, you can pay me now or pay me later paradigm. Next slide. So our next priority is to deal with impacts of climate change by enhancing community resilience. Legislators made a substantial investment in this category during the 2021 session, allocating some $600 million in state and federal funds. We'd like to see them allocate funding on the same level in the upcoming session. We'd also like to see them create a separate statewide office to take charge of resilience programs and create a sea level rise task force. Finally, we'd like to see them upgrade the Florida Building Code to address the impact of sea level rise, stronger storms, flooding, and other hazards to reduce the risks to homes and commercial buildings, and maybe to bring down all of our insurance bills. Next slide, please. Our next priority is for legislators to modernize and expand transportation options in the state by directing more funding to high quality transit systems, complete street initiatives, electric vehicle infrastructure, and other sustainable alternatives to toll roads and other highways. During their session earlier this year, legislators repealed the 2019 law that authorized the 330-mile M-Course network of toll roads through rural Western Florida. This was a win for the environment and for taxpayers. It will make more funds available to address more urgent transportation needs in other parts of the state, including in Palm Beach County. Next slide. And the last priority I'll mention is for legislating. I bet you all recognize that photo, but it's for legislators to agree to steps to curtail their practice of preempting the decision-making power of local governments. Preemption robs the local leaders of their ability and constitutional authority to craft and implement policies that are tailored to the unique needs of their communities. We believe legislators should put in place some of the same guidelines they've adopted for public records exemptions. And that includes requiring a supermajority for approval in both the House and Senate before a preemption can be approved, limiting preemption bills to a single subject, and requiring preemptions to be reviewed and reapproved every 5 years to remain in effect. Next slide, please, Camille. This slide shows a digital copy of our legislative priorities for 2022. It's available to be downloaded at our website at the address on this slide, or you can simply go to our homepage at 1000fof.org and click on Legislative Advocacy under the Toolkit menu. We'd encourage you to take copies to any meetings you have with legislators and share some with your friends. You can also keep up with the goings-on in the state capitol by tuning into our 3 free webinars on the upcoming session. The preview in December, the update in February, and the review in March. During the session, you can monitor the progress of bills on growth management, conservation, water policy, transportation, and resilience, also through our website. And you can keep up with the 2022 session by signing up for email alerts at our homepage. Last slide. And of course, we welcome your support for 1000 Friends of Florida. With your help, we'll continue our work, including our advocacy for Palm Beach County. So thanks again to Sal and NCNC for this opportunity, and happy to answer any questions anybody has.
Well, thank you, Paul. You should know we will put this up on our website as well, too. So the delegates have an easy access to it, and hopefully they'll, if they want to go further into your website, they have that address. Any questions for Paul? Let me see. I don't see if you have a question, either ask it or put a hand up. Okay, well, we get from Paul, I do anyway, you know, his annual report, his quarterly newsletters and so forth. They're very professionally done. I think, without trying to sell anything, from what I can gather so far, Friends of Florida seems to present a very balanced view of things. They operate pretty much along the lines we do. Sometimes we get people to agree with us and sometimes we don't. But we're not argumentative individuals. We try to get everybody to get the facts on the table and then work from there. So Paul, we thank you very much. I know you got to drive back to, I guess, Tallahassee, huh?
Actually, to Orlando this evening.
Oh, okay. All right, great. Paul used to be, what, many years ago, a reporter for the Orlando Sentinel or something? I think you were.
I was the editorial page editor there.
Very good.
A lot happier doing what I'm doing now. There's
Okay.
a lot in Florida we need to protect for our children and grandchildren. So it's all hands on deck.
Right. So we thank you very much, Paul. Appreciate your time. Safe travels back to Orlando.
Thank you, Sal. Thanks to everybody for your attention.
Yeah. My apologies, Ellen Baker, elected official from North Palm Beach County Improvement District. Where's Ellen? I see up in the upper right-hand corner. Sorry, my apologies, didn't miss you. So I just got to go across multiple screens to see everybody who's here. I don't think I missed any other elected officials. I want to take one more glance through there. No, we're good. Okay. Now, one of our other sponsors, who I have promised for quite some time the opportunity to present who they are, what they do, and what their game plan is going forward from a business point of view. But Lang Property Management has been a big supporter of the NCNC. You can see several of their representatives led by Marita Butzbach. And Marita and Marcia Adler are no strangers to the NCNC. They are oftentimes, when we had physical meetings or Zoom meetings, they are in attendance, so they know what we do and who we are and so forth. So I'm going to turn it over to Marita. Marita, they're all yours for the next 15, 20 minutes.
Thank you, Sal. I appreciate the opportunity for us to present today. Camille, if you could bring up the presentation for me, that we'll do a share screen.
You got it. Give me one second.
Thank you so much.
Okay. Everyone see it?
No,
Yeah,
Nope, it's not up yet.
Okay, I'm
Bring it.
sharing it.
you're in your documents.
Right. It didn't click out of your documents.
Interesting. Okay, let's try another one. I'll try it again. Yeah. How about now? because I see it.
There it
and
is.
say-
There you go.
There it is.
Okay.
It came up.
Okay.
Thank you.
Perfect.
So I'm Marita Butzbach. I'm the Senior Vice President of Lang Management Company. I've been with Lang Management for 29 years. I have the pleasure of working with Marcia Adler, who is the Mirasol Master Maintenance Association Property Manager. She's been with Lang for 13 years. And I'm very proud of the team that we've established in Palm Beach County, Boca Raton, and Port St. Lucie. If you could go to the next slide. Bill Isaacson is the sole owner of Lang Management. He's been the owner for the last 40 years. We have over 200 communities and 45,000 units from Boca Raton to Port St. Lucie. My home base is the Palm Beach Gardens office, which is located just past the fire station near Mirasol. We have about 175 employees and we have about 35 property managers who handle the communities for us. Like was said earlier, at the hospital, we have a team approach to how we manage our communities, and we're proud of the staff that supports all of those communities. We were voted by our employees as the best places to work. 2 years in a row, we placed top 10. So we're proud of that because we don't get to vote for ourselves. That actually was voted on by our employees and our team. If you could go to the next slide. We customize our services for management and accounting because our clients are very happy with us. We try to make your life easier as a board of directors when you're serving in the communities. It's very hard to keep board members, especially after a long period of time. They get worn down by the homeowners who live in the community and those special challenge homeowners. We try to make things easier and customize them so that your treasurer or your president, if there's something they would like to see done differently, most of our formats we can change and adapt to what you're looking for. We also are very proud of the emergency prepared and disaster recovery plans that we've put in place through COVID as well. We have at each one of our sites a binder that tells you from start to finish who's responsible for what. If we had to go into a disaster recovery, we plan it because we don't know if there could be a manager that is at their home or lost their house and can't make it to your site. We have others that could pick up the ball and keep going. So we try to keep those not just customized for your community. In addition to that, there's a standard that we follow for each one of the communities. So we would be able to jump in and handle that for you. We also have personalized websites that most of our communities take advantage of, that the homeowners find to be a big benefit, so they can contact your community pretty much 24/7. If we could go to the next slide. We work with your board of directors preparing your packages so they go out a week in advance, the Friday before your meeting. We put all the information you'll need for the meeting to make the decision so that you as a board can set your policy and we enact those policies and follow up and keep you informed of what's taking place before your next board meeting. We do include in that any reports that we've written, any proposals. And again, we try to make the board's job easier because we want to keep our board members who fortunately we've had for many years serving on our boards. If we could go to the next slide. On our financial services, our management team develops and reviews not only your monthly financials, but your budgets for the year. We work as a team effort. They do go to the accounting supervisor and also to myself and their supervisor for property management before they are given out to your associations or your treasurer for review. We give our recommendations on what we think you're going to need and project into the coming year. The manager does prepare the budget working with your treasurer, but ultimately we are responsible that we make sure you're fiscally sound going into the following budget year. If we could go to the next slide. We have a different approach than many management companies that we do this as a team. Your property manager has an administrative assistant We have a customer service department, and we also have accounting that they support each other so that it's not just your manager. They're actually managing staffing and the community, and they have support behind the scenes when they're in meetings or unavailable that are available to your board members. So if they call into the office, they don't necessarily have to deal with a property manager. There's other members of the team that know what's going on in your community as a comfort level that you're being covered across the board if they're on vacation or something should happen, they're out. We do have backup support. If I could go to the next slide. One thing, I'm sorry, I should have covered under the last slide. Our retention rate in our communities is 95% from turnover to current. And most of our employees are with us for 10 years or better. Sorry, I meant to cover that under the last slide. So I'm going to jump to our customer service and work orders. We have a program where homeowners can sign into our websites or to Lang Management and place a work order for any service they need. They can either email us or call into our service department. It's answered live. It's not an answering machine. We also have 24-hour service from emergency service, which is Rebecca O'Malley. She has been with Lang Management for, I want to say, 35 years. And she takes the off-hour calls from 5 p.m. Until 9 o'clock in the morning. And she gets in touch with the property manager or myself if necessary, if there is an emergency in your community. It's a good benefit to all of the associations because she does have access to your community information. So you have someone that's dealing with your emergency firsthand with your property manager. If we could go to the next screen. We have a very comprehensive ARC review program. Also on the next slide, we don't need to go to it yet, but it ties into our violations program. All of our property managers carry a tablet that has this program, Smart Webs, on the tablet. It's live when they're out in the community. If they want to look up an ARC or they want to look up someone who's in violation, they physically can do that out on the property. As board members, you also can look at that in real time. There's an app that you can put on your phone so that if you're out walking your dog or taking a walk for the evening and you're not sure of the status of something, you actually can bring that up and check that. If you go to the next slide. Under our violations program, again, as part of Smart Webs in the tablet, the manager can physically go out and take a picture of a property. If there is something they haven't pressure cleaned or their landscaping isn't being taken care of, they can take a picture and send it back to the office. By the time they return there, the letter will be done, the picture will be printed out, it's signed by the manager, and it goes into a tracking system so that we can follow up on that and make sure that the violations are being addressed and or taken to a grievance. If we could go to the next slide. I think the biggest advantage in one of the years, and honestly, one of the reasons I've been with Lang Management for the 29 years I've been here, is that we do have a team approach, that we all cover each other's back. We have monthly managers meetings where we train our managers on what's out there, the latest and greatest. We take a real pride in the relationship we have with Palm Beach Gardens, with the police department, with the city officials. And we really try to make sure that our managers have the latest tools available so they can bring those back to your association. Thank you. Someone said they had to head out early. I appreciate the message. But our training programs for our property managers, again, we feel are very valuable to us. On the next slide, I'm sorry. There it is. That these are the communities, just a sample of the communities we're involved in this area. We're very proud to be involved for 20 years plus in Mirasol, Ibis, PGA, our newest, Crestwind, Westlake, and Abacoa that we've been involved in 2 years, and hopefully we'll add to that portfolio in Palm Beach Gardens. But we appreciate all of the communities that have been loyal to us. Next slide. That is my contact information. If any of you would like to get in touch with me, and have any questions or need assistance with anything, please feel free to reach out for us. If you want to go to the next slide. I will take any questions that anybody may have and truly appreciate the time and the presentation. Sal, thank you so much for letting me present today.
All right. Thank you very much, Marita. Are there any questions that anybody has for Marita? Yes, ma'am, Dr. Alonso. Take it off mute.
Thank you for your presentation. Very interesting. I'm especially concerned, not concerned, but I'd like to know how you work with the emergency management operations center. You mentioned the emergency planning that you have, and that is so important for our communities to have that. Do you ever work with the county at the county level with us?
We do. We actually, Marsha, I'll let you answer that. Go ahead. I see you shaking your head. I don't want to steal the show.
I actually deal very extensively with the group for emergency management here in Palm Beach Gardens. One of the things that we've done is we put together our hurricane package, and every year I get with their city emergency worker, their directors, and we go over our policy, their policy, if they've added anything new. So we make sure that we continue that relationship, and we keep our policy with theirs. So we do it every year. It's really advantageous to everyone.
Well, thank you, and thanks for that cooperation. We're very lucky in Palm Beach County to have such a strong emergency management division, and
Very much so.
certainly all the communities play into it. So we're very fortunate. We worked really hard at it. Thank you.
Yeah, Dr. Alonso, let me just add, Marita, let me just add to that to give you guys a little commercial, because David Dinnan from Mirasol and I went to the Palm Beach County EOC, West Palm Beach EOC, Palm Beach Gardens EOC. And when we, went through those organizations, and they were very cooperative. I mean, they gave us everything we wanted. Just to kind of give Palm Beach Gardens a commercial, Steve Stepp and David Reyes gave us buku materials. We have their materials on our website. We have the Palm Beach County materials on our website. We have the West Palm Beach EOC materials on our website. All the hurricane planning documents we could possibly find are on our website. And thanks to Lang, given the work they did, when I went to visit them, because I had heard from community leaders that they had put together an outstanding packet, we have their materials that we distributed to all of our communities as well. So it's a very collaborative organization in terms of working together to figure out how do we advise our residents what to do in the event of emergencies beforehand, during, and after. So thank you to Lang, Marita, for your help, and Marcia giving us the time to kind of pick her brains on what she did and what she put together. It was very professional and very valuable to our communities.
Yeah, I think the other thing, Sal, is with Dr. Alonso, we actually did coordinate some local vaccination programs once serums and vaccines became widely available. And we actually, for our employees who couldn't take time off, to raise the vaccination rate. So I think cooperation there has been very strong.
Yeah, thank you, David. Yeah, very, very, very important point. And I would just leave you with the following thought, Dr. Alonso. This organization works very well together. We're not political. We're trying to get the information out to our communities as fast as you all, obviously at the county level, are sending it out to us. We send it out to them and reinforce your points and your messages. So these communities, they really abided by executive orders, whether they were from the state, whether they were from the county or the municipalities. We didn't run into any community that was kind of pushing back and saying, no, we're not following the county, or we're not following one of the municipalities. They were all very cooperative. The leadership is very mature and very professional. So, and thanks once again to Lang for what you guys did. I mean, that material we passed out to everybody. So we appreciate your leadership.
Thank you.
Thanks, Sal. So I have to tell you, and you would have laughed, I said to Marcia, I know how you keep the meetings on schedule. So I told her I had 10 minutes. And I had to narrow it down to 8, so I made sure I didn't go over my time limit. So
yeah, you're in good shape. Any
if
questions?
I spoke too fast, I apologize. I was trying to keep running the limit.
You did fine. Any further questions for?
Yes, I have a question.
Yes, David.
I would like to ask Marita, one of the things in your presentation that came across strongly for me, I had my own business for 20 years in Washington, D.C. Retention of staff, particularly senior staff, is so important for client relationships. Have you seen in the last 2 years of this pandemic, have you been able to maintain that level of retention?
We have been very fortunate, and none of our senior staff, I mean, all of our senior staff is, I think I'm one of the, I don't want to say youngest, but the least time frame of the senior staff. Boy, would I be in trouble with Bill Isaacson and Kevin on the youngest comment. But yes, all of our senior staff are still here. And I have to say, from our managers, most of our managers are 10 years or better that they have stayed.
That's terrific. Thank you, Marita. Thank you.
Thank you.
Okay. Thank you, guys. We appreciate your support and your sponsorships over the years as well. So
Thanks,
thank you
Sal.
very much.
Thank you. Sal.
Okay. I want to put a little commercial in here for Dr. Alonso. I mean, we've seen her on TV. We've heard her speeches with newscasts in the evening and when the county had its conference calls with regards to, communicating information, she was front and center, obviously giving leadership to the county and what should be done with regards to the vaccines and what should be done with regards to washing your hands and social distancing and the whole like. And for a while there, it was confusing to a lot of people, but I think she put some credence in front of the information to allow us to disseminate what we got from the county to everybody. So I would say, Dr. Alonso, your work was very effective. We appreciate that very much. You've got 20 minutes with the team here, so they're all yours.
Okay, well, I'm going to go ahead and ask to share, if that's possible. So I can share my presentation. Okay. I want to thank everybody for allowing me to come here and certainly for inviting me. Public health is one of those situations where we have health in every policy that we talk about, and every single person that has talked here today, from the hospitals all the way to your Lang management overview, all plays a role in our public health structure here in Palm Beach County. And not to brag, but I think we have one of the best counties that works together because we all come together for the same purpose of keeping our communities healthy and prosperous. So thank you so much for all that you do. I am Cuban and I could speak faster, but I see I have plenty of time to do this presentation. So next slide, please. Okay, so I'm not sharing. You're giving me the slides yourself then, right?
You can do it or I can do it, whatever's comfortable for you.
Okay, well, we'll go. I wanted to share mine because I have my notes on it. So if we can switch.
Sure, I'll stop
Okay.
share. And then you can take it from here.
Okay, wonderful. All right, so I'm going to put it on. I am sharing the screen. You can see it now. Is that correct?
Yes.
Yes.
Okay, so I'm going to put it on the big so you can see it bigger, and I will then click on it so that I can go to. I want to put it on the. There it goes, so I can go share presenter's view. Okay, so I'll start with this next slide that basically shows you where we've been since the beginning of January 22nd on the left-hand side of the slide, going all the way to October 22nd. You can see that we had the big peak in the middle of December, that peaking at January 11th. This is in the US, and this is very similar to our curve that we have had here in Palm Beach County. We then had this big large peak after July 11th. We were very, very low in June, actually the lowest we've ever been. We were actually in the upper right-hand corner. You see where it says community transmission. We were in the yellow, which is moderate. And I'll tell you how important that community transmission is so that you can understand it a little bit better. As you see in the US, our number of cases starting in the upper left-hand corner, you can see that in the last 30 days, we have had really a very good curve going downward. We want to keep making that go down so that we can ride the spike that will occur in the winter as we get into the winter months. So we want to go down as low as possible so that we can ride that up, that we will see a little bit going up in the winter, hopefully not too high. The deaths have actually increased a little bit, mostly in the northern states, Montana, North and South Dakota, Alaska. We believe that might have to do with the winter. As the winter comes, the viruses come and are more prominent. So we might have a little bit of a, some of this virus coming up from the southern hemisphere as it travels up to the northern hemisphere in the winter. Our general population in the United States is at a vaccination rate of 77.6 of all people 12 years and older with at least one vaccine. But what we really want to look at is total vaccination. In other words, those people have completed their series, and we're still in the high 50s on that. So until we get to really a global vaccination rate, we're going to have to be living with this COVID virus. And I think that is something that we all have to get used to, that this is not going to be over until globally we can really vaccinate the whole world, because we live in such a global world now, and travel and everything else that occurs. So a lot of what has happened and a lot of what has created the spikes obviously is because of the Delta virus. Right now, the Delta virus makes up 99.9% of all the variants in the United States. These variants are checked and tested by the CDC and the World Health Organization. They keep track of all the other variants that are also occurring. All viruses have variants. This is not something new. That is one of the reasons that there's so many diseases in the world that haven't been eliminated, such as malaria, that kills more people every year than any other virus, and tuberculosis, another one that kills a lot of people in the worldwide. So this vaccination now with the messenger RNA actually has been given way to a trial with malaria that actually was implemented not too long ago. If that occurs and we're able to find a vaccine for malaria, that's going to be another one of those advances in medicine that allows many of these countries to have a longer lifespan. All the advances that we have had in medicine, we always think of fancy robotic advances and things like that, but what has actually increased our life span is vaccinations. So you can understand how anyone in public health, when we see people rejecting vaccines that have stopped polio, we've eliminated smallpox, it's very difficult for us to believe that we're in a situation where people don't believe in these vaccinations. So this is going to be very important going forward, how we proceed with this. So this is what we look like in terms of our rate of cases per population. And you can see that Florida is in the lighter green here, not the very light green, only Puerto Rico and some of the our territories are in the light green, but certainly we're getting there by going down, as opposed to being at one time just a few weeks ago, we were actually in the dark blue. So this is all very encouraging. This is determining the community transmission risk. This means how risky is it for the community to obtain this virus. Now, there are 4 levels. The highest one is the dark red, okay? That is when you have over 100 cases per 100,000 of population. And that's a number that we are tracking now, okay? That's a very important number. Then it goes down to substantial in the orange, moderate in the yellow, and then low when you're below 10 new cases in 7 days per 100,000 population. We have never gotten to that low. There's one county in Florida right now that is in low. We got towards the end of June, we were actually in the yellow, in the moderate, and we were hoping to turn, we were the first metro county to turn yellow, and we were hoping to turn blue, but we were actually at a 44 new cases per 100,000 population. So we were almost there. We just had to go down below 10. The other number that's very important is the one below that line, which is the percentage of the positive tests during the past 7 days. So we call that the daily positivity rate. That number has to be below 5 to be in the low. Right now, we are actually below 5, and we are good in that number, but we're still in substantial. Why? Because our number per 100,000 is still in that yellow area as of the last report that we had. So as you see in that box up above, it says if 2 indicators suggest different transmission levels, you pick the higher level. The school board has chosen that when they get to moderate, they will be able to relax their mask mandate. At this level of high and substantial, the CDC continues to recommend that masks be worn, especially indoors. Of course, we don't have that recommendation from the Department of Health at this point, but those are the CDC recommendations. This is where we were in number of cases per week. Our lowest was there in June 11th, where we had 660. That's the lowest number of cases per week that we had. At the peak in August, we were up to 9,000. If you see to the left are the numbers of cases per week, you can see that the peak went above that 9,000. So big difference. We're now down to 1,062 cases per week. We're just below that line where we were in mid-June. So you see the arrow is below that line, and the 1,062 is right where we are as of now towards the end of October. So we need to go down just a little bit more. So when the winter comes after Thanksgiving and we start getting into the holidays, if we go up a little bit, if we can go keep this way down, we'll be able to ride that curve. These are our numbers that are reported every Friday. The state reports this up to the CDC once a week, and it's on Friday. The report comes out around 5 o'clock in the afternoon. The reporters don't like that because they want to get it out early, and they're always trying to get me to give them the preview of our numbers, and I just smile and tell them that I can't do that. So sorry. So as you can see here, our in the middle where it says new case positivity last week was 3.4. So that's below the 5% that would put us in a blue low transmission. That went down by 0.7%. And our cases per 100,000 is at 71.5. That went down by 24.7 points. So as you can see, that 77 is what still puts us up in substantial. So you pick the highest of the two, and that's why we're still in substantial at this point. Here is where we are, Palm Beach County in the highlighted area there on the bottom. You see that all our metro counties, that includes Miami, Broward, Palm Beach County, Hillsborough, and Orange County are all in the substantial. We have that one little blue spot, which is Union County all the way up. And we have 4 counties that are still in high, and that's Volusia, which went up. They were actually in orange a few weeks ago. They're now in the darker high range. We have Hamilton, Lafayette, and then Holmes are still on high. And then we have lots of yellow, which are in the moderate where we were back in June, and our surrounding counties, Collier to our west, Sarasota, and then Okeechobee above us, and Indian River are all in that moderate. So I think we will be dropping to that yellow very soon. Again, that'll be very important so that we can ride out the winter. Our numbers of vaccination, this is just a graph that shows it by ages, and we the lowest number, the blue line all the way at the bottom, is the 12 to 19-year-olds. We did that so we could see where we were in terms of the school age kids. And the school age kids are a little bit above at 57.3%, where they have been vaccinated with their 2 doses or their the 2 doses with Pfizer. And then the older kids or the young adults from 20 to 29 are just below them at 54. Now, if you take the over 65, then you see that actually the 60 and the 70-year-olds are the top 2 lines. They're over 90%. So when you look at this chart that's on the right, it says total vaccinated at 75%. That's a little overinflated because of all those very high numbers for the 65 and the 70-year-olds. The 80-year-olds are actually at 80%, and so are the 40 to 49-year-olds. So we have to work on those younger groups to get them up a little bit higher to make our total vaccination up above the 80%, so we have our community. I think that will happen shortly, especially with the new vaccine coming out for the 5 to 11-year-old by Pfizer. It should be out by Christmas. So we're hoping that as the winter comes, that those kids will be able to get vaccinated. So many of our families have their whole family vaccinated except the younger kids, and they're really very anxious to get that going. Miami and Broward are ahead of us in terms of vaccinations. We have a little bit of a different population. We have more folks here who are actually very hesitant to get the vaccine, and that's keeping our numbers low. So there's a little bit of difference in terms of the population, especially Miami has a very vaccinated friendly population that, you know, they go and get vaccinated very, very quickly and have always been vaccinated ahead of us. So our population does make a difference. The other option that we have also is our monoclonal therapy that is available for individuals who get COVID, whether or not they've been vaccinated. If they're at high risk with any kind of medical conditions that would put them at risk, they're able to go to one of these sites. Our site here in Palm Beach County is at the Wells Recreation Center at Westgate Recreation Center. I'm sorry, Wells Recreation is in Riviera Beach. I always get those two confused. So the center at the Westgate Recreation Center has seen over 6,700 cases that have been getting the monoclonal therapy. The monoclonal therapy is simply an artificial antibody that's injected into the body by either infusion or by giving it subcutaneous in 4 sites. They give you 2 in the abdomen, 1 in each arm, and that helps your body then create the antibodies to fight off the virus, just like the vaccine does, except that these are artificial antibodies, whereas the vaccine gives you natural immunity from your own body, making stimulating the white blood cells, which then create the antibodies against the virus. That is why the vaccine is so much more effective than your own natural immunity, because it creates a larger number of antibodies, as long as your body and your immune system is working well and working accurately. That is why the boosters were then recommended for those individuals who had a compromised immune system. And that's where the whole issue of giving those boosters started. So to just clarify that a little bit, because it's been so confusing, right now the boosters are for individuals who receive a Pfizer, a Moderna, or J&J. We now have boosters for all of them. And they're eligible for this booster after 6 months of getting their last vaccine. The Moderna boosters are half the dose of the original dose, and the Pfizer and the J&J are the same amount. So they will be the exactly same amount that you got, the same medication, same vaccine, okay? So the Moderna is half. So instead of 0.5, you're going to get 0.25 for the Moderna. And it's for anybody now that is over the age of 65. Anybody can get a booster. You don't have to ask for a 3rd dose now. You can ask for the booster. Or those people who are above the age of 18 and have one of these conditions. So for example, if you live in a long-term care settings, to the right, I list some of the facilities that are long-term care facilities. They can be any type of nursing facility, psychiatric setting, substance abuse facility, a senior or disability housing, and any congregate or senior day care program. So if anybody is any of those areas and you're above the age of 18, you can get a booster. The other way you can get a booster is if you have underlying medical conditions, very broad, any cancer, kidney, liver, heart, lung disease. If you've had an organ transplant, if you have HIV or AIDS or TB, if you've had strokes, diabetes, any kind of dementia, especially pregnancy, please do not believe that the vaccine causes sterility or infertility or anything like that. If you are pregnant or planning to be pregnant, it is very important that you get the vaccine, because during pregnancy, your immune system goes down. And if you get COVID, you and your baby may have a bad outcome. So please encourage people who are pregnant or wanting to get pregnant to get vaccinated before. So the rest of those things there, sickle cell, thalassemia, Down syndrome, cystic fibrosis, any kind of mental health disease or problem. If you're overweight or obese, it's very important. That of itself has caused a lot of having problems once you get the COVID. The COVID doesn't only affect your lungs, it goes into the other organs like your liver, your pancreas, your bones, certainly into your brain. That's what is causing some of the long-term effects that people have after you get COVID. If you have any substance abuse, even if you smoked or used to smoke, that affects your lungs. So that is recommended that you get the boosters. And anyone with a weak immunocompromised system, so that's whether you are taking any medications that cause you to have a weak immune system. The other part is if you are working or live in a high-risk settings, and that's the other bullet that I have here to the right. That includes first responders, all healthcare workers, firefighters, police, any congregate care staff. If you're in education, whether you're a teacher, a support staff, a janitor, anybody working in the schools. If you work in daycare centers, anybody working with food or agricultural, manufacturing workers, correction workers, U.S. Postal Service workers, public transit workers, for example, all our bus drivers, or if you work in a grocery store. In other words, what they're looking at is any situation that you're working or living where you're in contact with a lot of people. All those folks, even above the age of 18, can get the booster now. The booster are available at the pharmacies, at our vaccination sites, and they're really available. We have over 160 different locations in Palm Beach County where you can go to get a vaccine. I recommend that you make an appointment at the pharmacies. If you go to vaccines with an S, vaccines.gov, you can put in your zip code and you can see, you can ask for whether you want a Moderna or you want a Pfizer or a J&J, and they will tell you if they have it in stock and when you can make your appointment. They're all offering it now. And I recommend that you get an appointment so you're not waiting in line, or you happen to go to a place where they don't have enough of the they may be running out. But certainly now with everybody trying to get these boosters, I highly recommend that you make an appointment. The other thing that is new is the boosters that you may have heard is that now they are going to allow for mix and matching doses. It means that if, let's say you got the Pfizer before, we used to say you have to get the Pfizer. You got the Pfizer, the only way you can get your second shot or a booster was be to get the same vaccine. Now they're allowing you to mix and match as you prefer, or decide that you want one or the other. That's okay. You can ask for that booster to be a different than the one that you got. So in closing, we want to realize that this highly transmissible Delta variant is very contagious. It's 10 times more contagious than the regular virus, and it's the predominant variant across the United States. It's very contagious and causing the breakthrough cases that you're hearing. However, even if it does break through and you've been vaccinated, you have a very, very low probability of being hospitalized, and certainly even a lower probability of dying. That's the purpose of the vaccine. I like to make the analogy to wearing a seatbelt. You wear a seatbelt so that if you have a crash, you don't crash and die, right? And you survive. But if you run into two semi trucks, runs into your car and you have a tiny little car, you're not going to come out of there. So the vaccine is not a bulletproof guarantee that you're going to survive. Certainly if you have comorbidities, they can be very simple comorbidities, then you have a higher chance of having to be admitted to the hospital and or dying. The majority of the people who have had that kind of situation all have comorbidities. The vaccination remains the most important tool to stop the spread of the virus and to save lives. So please keep that in mind. The hospitalizations, as you already heard, are definitely decreasing. And I think we have to continue to praise the hospitals, not only the nurses and the doctors and the respiratory therapists, but everybody working in the hospital. They've been doing this now nonstop, shift after shift, for over a year and 10 months. We're going to come up in January. It will be 2 years that we're working at this. So please, whenever you get a chance, congratulate them. They are our heroes. And lastly, we can't let our guard down. We will have a spike in the winter. We want to make sure that we have enough people vaccinated by them to be able to ride that spike. So please get vaccinated if you haven't done it. If you have done it, then make sure you get vaccinated for the flu. The flu vaccine is out now. And if you need your boosters, then go get that too and be ready to take on the winter. I'm open for any questions that you may have.
Well, thank you, Dr. Alonso. That was exceedingly informative. And we really appreciate the hard work you did to put that presentation together. I've got a couple of questions, but before I ask, I want to turn it over to the audience to see if they've got any themselves.
Dr. Alonso, this is David Dinnan.
Hey, David.
Could you comment on what the county's plans are as we grow closer to 5 to 11-year-old approval as vaccinating children? Do you plan to do that at schools or doctor's offices or under the current system?
All of it, all of it. The doctor's offices, those who are given vaccines now will continue giving the vaccines. They're planning on working 7 days a week, being open in the weekends and on late at night. Many of these pediatric offices are working 7 to 7 to make sure that they can vaccinate all the kids. In addition to that, the pharmacists will also be able to give the vaccine to children. We're making sure that enough people are trained on how to handle a child. Usually what you do is you put the child with the parent holds the child, and you give the vaccine. The vaccine does not hurt when it's given at all. It's a very thin needle. How many of you had it? It really didn't hurt going in, right? There you go. So, you know, it'll be okay to give this to the kids. The dose is a smaller dose than they do for adults. And so the parents are really anxious to give this to the kids. That will help tremendously at the schools. Our numbers are way down now at the schools. And we're hoping to be able to get as many kids immunized as quickly as possible. So that is the plan. We will also have it available for anyone who gets the vaccines now. They'll be able to get the child vaccine, which is a smaller dose. So that will come separately packaged and identified that it's a pediatric dose.
Any other question, David, you had there?
Nothing you want to hear.
Oh, come on.
Well, I was going to ask you what, you know, I do see, since we have city officials on, that we still have a strong resistance from some of the police departments in supporting this vaccination of their people. And I was just wondering if we plan to do anything about that.
Well, from our perspective, we are trying to get the message out to them. I think at this point, you know, public health has never been political. Unfortunately, this virus kills red and blue the same. They don't care who you are or what you believe. And we have never been political, but it is political now. And so it's something that we have to accept, and we have to respect one another's views on this. And I'm glad you guys feel that way. But it's very sad to see somebody die that doesn't have to be dying. It's very sad as a physician to see somebody on a ventilator that doesn't have to be on a ventilator. So for us in the medical field, this is extremely, extremely hard to do. We have never been against vaccines in this country. We have been a country that has vaccinated. During H1N1, we did exactly the same thing. We had an emergency order, always been done in an emergency, always been done in a pandemic, because you want to get the vaccine out quickly. We didn't have any hesitancy with H1N1. We gave the vaccines out and we were done with it in 2 years. We were completely done. We had the first wave that came in the winter, and then it was over. Probably most of you don't even remember anything happening in 2009 with the pandemic, with H1N1. So I don't know how this has occurred, how it's become politicized, but all we can do is keep trying to vaccinate those people that want to be vaccinated. I can't go chasing somebody that believes it's a sign of the beast, or that, all this stuff, all this misinformation is being sent out to us on purpose to split us apart. And they've been very successful at doing this. So I hope that slowly, as people see people that they love get sick and or die, that they will change their minds. But I'm afraid that because this is happening, not only here, this misinformation is being spread throughout Europe, throughout the country. These things are being translated in these bots that do this kind of misinformation, the internet, do this and spread it out throughout the world. And so we're seeing this hesitancy globally. That's why we're going to continue dealing with this virus for some time to come.
Dr. Alonso, in our own case here at our community, 55%, which is a low number, of our staff have been vaccinated. We have certain segments of our staff, not in any way to be discriminatory, but the facts are the facts. Haitians are reluctant, Latinos are reluctant, and minorities are reluctant. And we don't know how to get the message across other than to give them information such as you're passing on to us. Is your presentation, you're going to give it to us so we can put it on our website and send it out to all these delegates? if
We
they
have
wanna
it,
use
so.
in their
Yes, you have
communities?
it. And it's the same information that I give the Board of County Commissions. I'm giving you only the facts. I don't have any opinions or, everything is quoted from the CDC. It's pretty much the information that I'm allowed to give out. And I agree that the minorities, but I do this in Spanish and Creole and English. And what I've told the minorities, especially here, our minorities here in Palm Beach County are very different than the minorities in, let's say, Dade. Dade has a very large Hispanic population that is very pro-vaccine. They may be different political group, but they're pro-vaccines. And so they have taken the vaccine. We have a different group of Hispanic groups here. And we have a very large Haitian community. And then we have a lot of farm workers. Now, what we have done, I think we've done a good job with the farm workers. We've gone out to the farms to vaccinate them, and they've taken the vaccine. Their problem is that they can't get to the sites because they're working during the times that we're vaccinating. So we have done evenings. We have gone to the Guatemalan community. We've gone to the Guatemalan Center where they trust going there. We've also gone to different businesses along the corridor in the Lake Worth, going out west, that has, one of the lowest vaccination rates. So you're right. We have these minority groups, and we've been trying to go through the churches and through other community leaders to get them vaccinated. But it's very frustrating to deal with all that misinformation.
Yeah. Let me ask one other question, and I've always been concerned with this. As flu season starts to, it's arrived. I've taken my flu shots. I've gotten all my COVID shots and so forth. I will be taking my booster here in the next week or two. But is there any distinguishable difference between if you have the flu or you have some form of the variant or COVID? I mean, how do you know what you've got? We all don't want to be running to the hospital. I mean,
yeah, you do not know. So that's one of the other problems with COVID. It's very vague. Some people only get a headache. That's all they got. I mean, if you ran to the hospital every time you had a headache, that's ridiculous, right? So my best advice is don't come to work if you have any symptoms at all. And because you can distinguish between the flu and the COVID, that's why I recommend that everybody get their flu vaccine. Even if you've never gotten your flu vaccine before, these are the years to have it. Last year, we almost had no flu. Why? Because people were wearing a mask. People were not going anywhere. They weren't going into crowds. They were staying home. They weren't eating out. They weren't going to the places where we catch viruses. And how do we catch viruses? We catch viruses through people speaking, yelling, especially at bars when you're asking for that tequila and you're reaching across for that shot. That's when you're going to catch it, because you're speaking loud and your voice and your saliva is going further. And so that's where you're getting it. And if you go down any of our, bars and entertainment areas, you see this. It's very easy to see. So we got to be careful. We can't let our guard down. And we're going to stop this by being careful, getting our flu shot. But if you have, that's another issue. People that don't have insurance, if they don't go to work, they don't get paid. And who are the people? The majority of those people are people working in restaurants, people working cleaning houses, cleaning hospitals, cleaning, all these, and they are the very ones that are hesitancy. So we have a whole group of population that's the hardest to get vaccinated, who are also at the highest risk of spreading it.
Okay, well, very, very informative. This is a great opportunity for all of us. This information is going to be on our website. You'll have an opportunity to go into your communities and reveal information to your residents, obviously your boards, and obviously get their support to disseminate the information. I mean, without getting political, whether you take it or not is your decision. I'm not telling you to take it or not take it, but it's very informative and base it on facts, I believe, rather than just an emotional statement. So thank you, Dr. Alonso. We really appreciate your time and all your effort, obviously, to try to keep us healthy and safe and sound. We appreciate that very much. And thank the rest of your staff. We know that, many times the people behind the scenes don't get thanked, but we want to make sure we reach out to everybody to say thank you very much.
Absolutely. Well, thank you for having me. It's my pleasure. And everything that you talked today is all part of our health and all policies. The air we breathe, our land, certainly our all of our emergencies, all our disaster planning, climate change, and the rising sea level, all those things are part of public health. So thank you, thank you, thank you.
Thank you, Dr. Alonso. Okay, we're about to close here. Don't forget the invoices for your dues to the NCNC will be coming out shortly. We'd appreciate your support in getting the responsiveness back. We've got a new address, once again, 8225 Ibis Boulevard, 33412 on the zip code. And I do need your feedback. I know David told me, and I'm a veteran too, so I'm very sensitive to December the 7th and what it represents to our country. But December 7th or January 25th were the two dates that were seemed to be most readily available to us. So we just need your feedback. Which date would you pick? I'd hate to go very candidly November, December without a meeting, but if we have to, we will. Okay, has anybody got any burning question they've got to ask or comment they've got to get off their chest before we say adjourn? Okay, guys, we're adjourned. Thank you very much.
Thanks,
This is your-
Sal.
Thank you so much.